Well, hello, hello, Nurse Mo here. And as I was cleaning out my office, I came across the bag. Can you see how awesome this bag is? I came across this bag that I used to use when I worked in the ICU. I work in the PACU now. I don't take nearly as much stuff with me to work, but I thought it would be interesting to go through this bag and really evaluate, did I actually use this? Would this be helpful for you to have in your clinical bag or your nursing bag? Okay, so let's dive into this thing. So, this is what is this? And I'm looking at some of this for the first time in years, you guys. All right, these are goggles. Really handy to have if you don't want to wear the hospital supplied goggles. So, if the hospital supplied goggles, you can't see through them very well or they're uncomfortable, get a pair of your own. Highly recommend. Okay. Next up in my nursing bag is 2 packets of Starbucks Via instant coffee. Yes, I used the heck out of this. If your hospital has a Keurig machine, you could do that as well, but this is a little bit more sustainable because you're not throwing away a ton of plastic. But when you need a quick hit of coffee and you don't have time to run to the cafeteria, this can be really great. So I'm going to give that a yes. Give that a yes. All right, I have a spare pair of scissors. I'm going to say yes to a spare pair of scissors if you're like me and you tend to leave them laying around and people take them. I also recommend you get like crazy scissors, wacky looking scissors, so that they're easily recognizable as your scissors and you can put your name on them as well. So spare scissors, yes, I'm going to say thumbs up on that. All right, I love this thing. This is Kathy White's Fast Facts for Critical Care, and can kind of see it. Lots of facts, all kinds of stuff. I used the heck out of this when I was a new nurse, probably for a long time. I used this book and then I added things to it. Like I don't know if you can see it with the glare, but I added this whole table on drips, different drips we use in the ICU, and a little note, how to measure pulsus paradoxus. Okay, so yeah, different things in here. You could look stuff up really quickly. It's absolutely fantastic. I love, love, love this book. So they have different versions. I obviously she has one for critical care. I believe she has others. I think there's one for emergency care. You'd have to go look. Check out Kathy White. She's awesome. I love her books. Okay. A spare scrub cap. Great if you don't want to do your hair and you want to keep your hair out of your face. So I would recommend a spare scrub cap. So far, I have not said no to anything in my bag. Okay, hang on. Let me just move some stuff out of the way. All right, a super old bar. Okay, I highly recommend having a snack of some kind in your bag. And a Laura bar, obviously. I didn't want to get stuck without food. This was really handy. This was a badge card that I made with some common phone numbers for numbers that we called a lot in our unit, and I actually made one of these for everybody in my unit, and I was like the favorite person for a long time after that. So frequently called numbers, if you have them on your badge, super, super handy. Okay, we'll do that one in a minute. This is my clinical notebook, and I haven't looked at this in ages. So what this is, let me see if I can find a good example here. I would learn something and let's get where we can see this. And I would write it down. So I put letters on the pages so that everything could be alphabetical. And then when I learned a little tidbit, I put it into my little book. So for example, this talks about dobutamine and how it increases cardiac output, decreases SVR, increases MAP, lower CV, just all this stuff. It's inotropic and chronotropic, and the range is 2 to 10 mics per kilogram per minute. Yeah, so I wrote that in there. Oh, that was dobutamine. Did I say dobutamine? Sorry, I don't have my glasses on. I can't really read it. Anyway, great, especially if you're new, as you're going to learn things constantly, and you don't want to forget them. So I recommend a little clinical notebook. This is a Moleskine notebook. It's great, fabulous. Highly recommend. All right, we got to come across something that I'm going to say I didn't need. For a while, I was keeping Epic notes when I was brand new, but I ended up not really maximizing this. So I'm going to say this was not necessary. Just you'll get better at Epic the more you use it. So that's going in the don't need pile. Okay. Oh, this guy, super handy. This is a level. a little portable level for leveling your art lines, CVP lines, whatever hemodynamic monitoring that you're doing. It needs to be level. And you can use one of these. See, there, we're level. Perfect. To get that level for your patient so that you get the right reading. So this, I highly recommend if you can get your hands on one of these. It's really handy. We used to actually just carry a giant level around the unit looking like Bob the Builder, but that actually is a little bit better. Okay, next we have a tin of Altoids. Yes, because I'm drinking a lot of coffee, I want to be fresh. I'm going to put that in the yes pile. Okay, let's see here. I've got a little pouch. Let's see what's in the pouch. Gum. That goes with Altoids. I'm going to say yes on that. Oh, this is a little bag of makeup. I don't know that that's necessarily needed. I think I probably had this in my bag for if I was going to go out after work. I could touch up my makeup a little bit, but I'm so glad I found this because I was looking for some of this stuff the other day. Yay, I found it. Awesome. All right, another little bag here. I just love little bags, apparently. In here, I have contact lens solution. I have cuticle cream. I get dry cuticles, and when they're dry, I tend to peel them, which is a terrible habit. So putting cuticle cream on my hands, especially in the hospital, because you're constantly washing your hands, they can get really dry. Highly recommend if you have space in your bag for something like that. They don't make this anymore. Can you see that? Oh, wait, let me turn it around. It's called a snuff stick. They don't make this anymore. It smells good, and you can put it on your nose. And then you smell this and not other things. They no longer are in business. So what I would recommend is if you can get a hold of a little container like this or something like this, like a little container, and put some Vicks Vapor Rub in it for those odoriferous situations. You can put a little Vicks Vapor Rub right under your nose and then put your mask on, and then you smell that instead of something that might not be so great, and you don't ever want to show on your face that you're noticing an unpleasant odor because that can be embarrassing for your patients. So we just disguise, poker face, always a poker face, right? A pen light, which still works. Hey, these things last forever. Handy. If your hospital doesn't always have one handy for you, you can just keep one in your bag. And some hand lotion with my name on it because I didn't want anybody to steal my hand lotion, apparently. And then I've got toothpaste and breath mint drops and breath strips. Clearly, I'm very, very concerned about being fresh. Okay. Let's see here. Nothing in there. Spare N95s because we were hoarding these for a while. More N95s in the back. And then just a couple pockets left here. All right, we've got cute badge reel, for the seasons. If you want to switch up your badge reel, it's nice to have a fun badge reel ready to go. Pens, obviously. And what's in this pocket? Oh, yes. And okay, so we've got calipers. If you're doing manual EKG measurements, you can use your calipers. I usually just use the monitor calipers, but in a pinch, I've got these guys. And then I bought a bunch of these vials. Check this out. Okay, so in the ICU, a lot of patients don't make it. And a really nice thing that I would do when I had a patient that would die and their loved ones were there, I would print take one of their heart strips, and they were like this wide. I would cut them to be about this wide, and then I would roll it up and put it in here and give it to the family member. And I'm telling you, people really loved that. It's super touching, something they can keep and remember their loved one by. So I really liked doing that when I had a lot of patients that would be like on comfort care or hospice care or something like that. Anyway, and the other thing here we go. I forgot. Oh, I've been looking for this too. A nail file, because you get the snaggly nail. You don't want that. And I don't have it here with me, but the other thing is I don't have it here. I would love to show it to you. It's a clipboard. I like to use a clipboard so that I can have an organized place to keep my report sheets and run sheets and those things. And then I've got another pouch. My favorite day is Counter Day. And what's in here is more hand cream. Obviously, I get very dry skin in the clinical setting. And I don't know, do we need a pen? Anybody need a pen? I would show up to work with a million pens. Okay, that's great. Sharpies are fabulous for labeling things, writing on some tape and labeling things. I've got Sharpies in all colors here, all kinds of pens, highlighters, hemostats. I love these things. I use these all the time mainly for when somebody would wrench the IV tubing on too tight. You could grab it with the hemostat and really get a little bit more leverage. Use these all the time. A little mini calculator for figuring out any kind of calculation that I needed to do, a PF ratio, a drug calculation, what have you. Little calculator and spare calipers, because you never know when you're going to need more calipers. So those are the things that I carted around with me to the ICU every day. Now in the PACU, I take, and my stethoscope, obviously. Now in the PACU, I take my stethoscope, some water, some pens, and just have a good day. But in the ICU where I was working much longer shifts, and needed more resources and things, this is the type of stuff that I would take. So there you go. Hope that was insightful and helpful.